a few slides to share, and this acupuncture treatment for stroke is a standardized treatment in China. So in each hospital there is an acupuncture department, and I heard in Germany and Israel they all have acupuncture department, and the government pay for it. So I guess there is some kind of effect that help stroke patient recover. And simplifies how this acupuncture works is it strengthens the muscle. So when in clinic, when the patients finish the PT for a year or two, and they still have dramatic muscle atrophy, and when they come to acupuncture, if they could do twice a week for 3 to 6 months, you can see the muscle atrophy get improved. So that's evidence-based. And also, you can see the improved circulation. They usually have cold hands and feet, and after acupuncture for a while, and then the circulation get better. You can see instantly dilation of the small blood vessel on the hand and the feet. And also, it facilitates the peripheral nerve regeneration. That's why even you exercise so much, the muscle atrophy is not improved, but after acupuncture, for a period of time, it could improve the muscle atrophy. And the mechanism, one is it has anti-inflammatory in function. Like using 10 hertz electric acupuncture can activate the hypothalamus, pituitary, adrenal axis, and increase the cortisol level, and that measured in the rats. So if you use electric acupuncture for 20 to 25 minutes and measure the cortisol level, it's increasing, but there's no stressful sign like increased heartbeat or irritability. So it's improved the adrenal gland function, not just to bring up the cortisol level. There is a research done by Chow, and I didn't write down the journal's name, but if you search the name acupuncture and stroke, you'll find it in PubMed. So they stimulate the stomach 36, which is called the Zhu Sanli. It's 3 inches below the eye of the kneecap. It suppresses the hemorrhage-induced lesion size and apoptotic neuronal cell death in the striatum in rats. So that's animal study. So because it reduced the lesion size, so it possibly can help recovery following intracerebral hemorrhage. So that's one study. And also there is another study shows that in neuroscience letter that especially electric acupuncture twice a week, and in the animal study they do every day for 30 minutes. So if some study shows acupuncture is not working, probably the dosage is not sufficient. So in the animal study, they will use every day for 20 to 30 minutes, and that can increase the GABA immunoexpression. And the GABA is an inhibitory neurotransmitter which have the neuroprotective effect. So that's another evidence that if we can do acupuncture early after the blood pressure is stabilized, then it has neuroprotective effect. That's it. Any questions?
EA compared with the real acupuncture?
The manual acupuncture?
Yeah.
Yeah. Electric acupuncture, all the research is based on electric acupuncture because you can control the frequency, intensity. For the manual one, it's hard because each practitioner, it's different. You cannot standardize that. And for me, in the clinical practice, I use electric acupuncture because, first of all, we use very skinny needles in America because they're all super sensitive because of the coffee, because of the stress. So in China, we use very big size, like 28 gauge needles. But here, you can barely use 34, 32, and they will jump. And so that's reduced the effect. And the other thing is they won't allow the practitioner manipulate the needles. If you try to induce like numbness, pressure, sensation. They don't like it. But with electric acupuncture, they're okay. The only exception is that when people have constant anxiety or panic attack, they don't like it. They feel like they become more anxious afterwards. And the other thing is if patients have hypoglycemia, they tend to have low blood pressure with electric acupuncture. So I always ask if you eat. If you don't eat, you give them a banana, not candies, because candies only last like 30 minutes. And after acupuncture, their blood sugar drops so much, they can faint if they have diabetes.
That's good. You can control diabetes.
You can lower blood sugar instantly, yes.
So which instrument do you use? I know in China, Dr. Han
Uh-huh.
he invents the machine.
Yes, yes.
What do you use here? Do you use the one special made in USA and similar?
Usually it's made in China. There is a Japanese-made machine, but I compare. I don't think it's so expensive, and it's not that much differences.
When you use that, you are clinic to bill. How do you bill for this?
Oh, there is a code. There's standardized code, and Blue Cross Blue Shield in California, they covered because, especially the finance company, because the CEO, they all go to acupuncture, so they made the insurance covered. But not here. Here, very limited. Yeah, here in Massachusetts, they don't cover. And you only bill like 2 codes. I have a billing agent, he bills very well, and they pay very well. Yeah.
Either you manually or electronically also set the code.
Yeah,
In the
that's it.
ICD and in the billing code. So you bill the first 50 minutes, every 50 minutes after that you bill another code. So you need to have a standard code. Actually, I do have a question for Dr. D. Do you find any difference between the frequency of electric acupuncture stimulation for treating the stroke, like low frequency or middle frequency or high? Is there any
I think alternate would be better, like the alternate between low and high, because just one frequency, it seems like it's the nerves just get used to it. It's just desensitized. But to induce it for different purposes, for the quick pain relief, I think high frequency is better. But low frequency is slow, but it lasts longer for pain relief. But for improving the circulation and regenerating peripheral nerves, I think alternating is better. I think every couple of seconds, because it's fixed in the machine. You really cannot change that. No. The machine will, the machine setup change. Yeah.
Another question is, do you have any experience comparing scalp acupuncture to body acupuncture? Any therapeutic perspective?
I usually combine both. So the scalp is very relaxing. It seems like there is 2 points which in Dana-Farber they use to treat anxiety and panic attack, which is the GV20 and yin tang, and it's like tranquilizing effect, and the patient just quickly kind of relax, and also I find out it's kind of rewire the brain that, for the depression people, they tend to think things over again, but by doing the electric acupuncture, it seems change the neurotransmitter right away, so they stop thinking that way. So it's like initiation of a new circuit in the brain, like electric shock, but it's much milder.
So which way is better?
The manual one? Which way is better? It depends. If just purely for relaxation, just for stress, not for pain, not for other things, then the manual one is better. But if you want to strengthen the muscle, improve the circulation for peripheral nerve regeneration, then the electric stimulation, I think it's better.
And another question is, how does it work? How does acupuncture decrease the blood glucose level?
Oh, the glucose level? I think one of the reasons is that it brings the energy or it improves the metabolism. It's some reason it changed the chemicals. It's one thing definitely it increased the peristalsis of the intestine and the stomach, so they digest better. So it might switch the metabolism instead to transfer the blood sugar into fat and stored in the fat cells. It probably burned those calories. So that's probably changed the metabolism.
So let's say stimulate the metabolism in another way instead of the stock energy, but to
Yeah, improve. Because certain points like stomach 9, the stomach channel runs to the neck, the stomach, it can improve the thyroid function temporarily. So it's kind of a change the chemical balance. There are a type 1 diabetes patient, and the young acupuncturist treated him, and then he started driving and he fainted because he didn't eat after the insulin, and then he had acupuncture, so the blood sugar dropped to very low. So it's kind of dangerous.
Okay, although it's short, I think Dr. Lee's lecture gives us a lot of insight information. Let's give a lot of